Hi, my name is Leslie. I'm going to be doing the week 1 assessment of the skin for NU 650. I have my patient here, Brianna, and I'm just going to do a full assessment on her of her skin. I'm going to start from the top and go down to the bottom and ask her a couple of questions about her skin health. So, do you sunbathe? Do you go out in the sun?
I go out in the sun. I like to catch some sun. I do.
But do you for hours? Do you kind of bathe? Do you like to go to the beach?
Love the beach.
Okay. So do you wear sunscreen when you go to the beach?
Yes.
Okay, perfect. And you've never had any kind of situation where being out in the sun you developed a rash?
A couple of times. It was like after 4.5 hours in the sun.
Okay.
Became too
duration
much.
of time. And when was the last time you had that experience?
2014, 15.
Okay, so it's been a few years. If you seem to notice that seems to be a consistent pattern this summer, then we probably should address it, and maybe it's one of those things where you just have to be outside of the sun or wear more protective gear so that you don't have any of those kinds of issues. All right, so I'm going to check the temperature of Brianna's skin by using the back side of my palm, going all the way down. I'm also going to check her thighs and her legs. And everything seems to be even in temperature, nice and warm. The things that we would be looking for is just a difference in temperature that's drastic, especially in the hands, because sometimes that can indicate Raynaud's. I'm going to check her skin turgor here. We do that little pinching just to determine if she has a good recoil back to her skin and elasticity, which would indicate great hydration. Tenting would indicate dehydration. If I wasn't able to pinch, or if I was down at the bottom of her feet and I wasn't able to pinch, it might indicate edema, and we might need to look at some cardiovascular issues or any kind of issues like that as well. I'm also going to now take a look at her nail bed and just make sure that it's pink, that there's no lines or concerns or spots that we would be worried about, and that the capillary refill is appropriate, which it is. Her skin is nice and warm. All right, and I'm also going to actually just check her hair while I'm at the top and check her scalp. Do you have any conditions or issues that you're concerned about? Do you see any flaking? Do you have any dry spells or really, really itchy?
Mm-mm.
Have you ever had a history of lice or any kind of condition in your hair?
No.
Okay. Great. So I'm just going to do a head-to-toe assessment, looking at her skin, making sure there's no abnormalities, there's no lesions, there's no moles, nevus, anything like that, Mongolian spots that she may or may not have. I'm going to take a peek and see how her skin looks evenly. I'm going to start with her head. I do notice that she has some darker areas here, right underneath her chin, that extend down into her neck, and then they also go a little bit behind her ear, and they're literally just spots. But she, in talking with her previously, said that she has, it's a family history, and that it's a birthmark. So we'll just keep an eye on that. We can measure that to make sure that it doesn't get any bigger, or that it doesn't get raised. We'll check the borders. We'll use the ABCD acronym to kind of do an assessment of that. She has one small, tiny mole right here. One right here. But they're even in size. You want to bend your knees? I can see. So I'm looking at the soles of her feet as well. She does have 1 or 2 moles on the soles of her feet, but they're even in size. Again, I'm going to teach you about ABCD, and what that is when you see a mole, you want to just make sure that you're looking that it's the same, so it's asymmetric. It's not asymmetric. B would be looking at the borders and make sure the borders are not changing dramatically. You want to look at the color of them, the diameter, how long it is, how big it is, and then if it's elevated, if it starts to raise. You want to just take a look at all of those things and make sure that the mole that you've seen is not changing dramatically over time, and then come back into our office. So this concludes our skin assessment for my patient Brianna.